Good morning, everyone. Welcome to Sun Up on 7. If you're a Sun Up family, I can say welcome back. And if it's the first time you're joining us, thank you for choosing Sun Up on 7 to start your Wednesday and to enjoy meaningful conversations on what we like to call Wellness Wednesday. So, in that same avenue, we're going to start with our first conversation. So, welcome to that. We're going to be talking about the Belize Institute of Neuroscience. So, two things we're going to be having a conversation here is talking about thyroid awareness, but also talking about multiple sclerosis. And to talk with us, we have Dr. Andres Cervantes, a neurologist, and Dr. Virgilio Melgar, endocrinologist, who is all the way from Merida, a Belizean based in Merida. Let me clarify that. And he's joining us via Zoom. So good morning, doctors. How are you doing? Welcome to Sun Up on 7. How are you, Dr. Cervantes?
Fine, thank you for the invitation.
Thank you. Thank you for being here with us. Dr. Melgar, how are you doing?
Can you hear us?
You have to unmute your mic.
I think you have to unmute. Oh, yeah, he unmuted. Can you hear us? How are you doing?
Hello.
Hi,
Yes,
hello.
we can hear you.
Good morning.
Okay, perfect. Happy to be with you. Thanks for the invitation.
No
Thank you.
problem. And so we know we have limited time with you, and so we're going to get right into this conversation. First, before I
Thank
get,
you.
a level of understanding on what BIIN is, could you explain that first for me, Dr. Cervantes? And then
Okay.
we can go into, more thyroid.
Sure. In my capacity as a medical director, BIIN, Belize International Institute of Neuroscience, basically, it's a private company. The vision comes from a combination of medical experts and non-medical experts. The idea came about in 2018, physically conceptualizing and getting it to start and being on the scene per se was in 2019. Unfortunately, because of the pandemic, Belizeans don't know about it as we would like to. But talking about neurosciences, it involves experts both locally and internationally, especially people like Dr. Melgar. So the concept behind it is when you hear neurosciences and you think about endocrinology, it's like, what's the link? Well, it's a huge link because hormones are basically the majority are born in the brain. So BIIN, for short, what it is putting together people who look at neurological things, experts in that field, bridging it into the area of mental health, psychiatrists, psychologists, neuropsychologists, the neurology experts, orthopedic surgeons, the internist, the family physician, of course, the endocrinologist, the physical therapist, and speech therapists, nutritionists, anything that is bridging and is covering that realm. That's the primary focus, but eventually we do hope to go into other areas that have something to do with the neurosciences.
It's very interesting.
I know, that's
yeah,
a
to
huge
think about the
umbrella.
whole array of
Yeah.
services that it offers. So how does BIIN operate, Doc? Is it so you all have your own clinics and then people reach out to you, or do you reach out to you as a network?
Well, we have two locations at present, right? Two spaces. We are not a hospital.
Okay.
We are a clinic concept, outpatient clinic concept. So it is tapping into whether through face-to-face consultations or virtual consultations, whereby a patient will have the expertise that they need precisely at that moment. So people may go to one of our locations and perhaps see myself or another doctor that's there. Or, for example, Dr. Melgar, who is living in Merida and who practices in Merida, it is arranging a specific time that is convenient to both the facility and to the expert and to the patient, and whereby they can have the comfort of seeing their doctor with nice, fancy monitors, with nice cameras, good volume audio, and that way they're nearly feeling like they're touching their doctor.
Okay.
Okay. That.
All right.
Because with virtual, sometimes people like, how are you going to be checking me? How are you going to be able to talk to me? But the idea of almost, feeling like the doctor is there, I think that.
Well, if one of the experts needs, for example, some type of local, like one of our local doctors to be involved, an expert like Dr. Melgar, if he would ever to need it, can ask, can you have a general doctor on board? And then that person could be sitting in the location, and if that specialist doctor wants the general doctor to do something specific,
Right.
that can also be done, so that the patient doesn't feel that they're left shortchanged.
Yeah.
Wow.
Oh, wow.
I like the aspect of telemedicine. It's really coming up to the age of like 2022. We're here and technology is here, so let's make the best of it. So it's awesome to hear how this network comes along and the services and how people can have access to it. Do you have a website or something where people can reach out to see what doctors are there, what services, and how
Yes,
the contact
we do have a website under our name, Belize International Institute of Neuroscience, and if you look at it, it's a pretty It's a pretty complete page.
Okay.
And it talks about we look to diagnose correctly medical conditions, and we look to treat certain things. So we are investing in technologies that are not existent in Belize. We're not looking to compete with the existing private entities or the public entities. It is to complement what does not exist. Endocrinology is one of the areas that doesn't exist. Also, a service we give many times is that if we're overwhelmed in Belize, in the country of Belize, no health facility can offer a certain service, then we offer a type of concierge service whereby we link you to the specialists outside of the country. So if you say, for example, and I'm going to use Dr. Melgar, right? You need to go over there for something, we send you. We see how we can facilitate to send you over to Merida, or somebody wants to go to Cancun, or to the USA, or perhaps wants to see a specialist in a country like Jamaica. So we're doing linking depending on the preference that somebody would have. We don't have all the specialties as yet. Of course, we're trying to respect the ones that Belize already has, and we're trying to fill the gap where there is nothing available.
That is
Wow.
really
Yes,
progressive.
it's holistic,
I love that
convenient,
because
progressive.
filling the gap because we have a lot of gaps in Belize. And so to be able to have that networking, that collaboration, and knowing that, we're going to be connecting, people can still get the services, they can still get the help that they need wherever it is. I love that idea, especially in 2022 when pandemic is on, but everything is still happening. And when we talk about that, we go into the idea of thyroids. And so just because COVID is happening doesn't mean thyroid just took a break and said, I'm going to chill for right now, And so I think this is a very important conversation too for us to bring in. I would like to now to bring in Dr. Melgar in regards to that. So Dr. Melgar, we're talking about thyroid awareness and just the idea of it. Could you explain first for maybe viewers that don't know what thyroid is at all?
Hello. Yes. Well, the thyroid gland or thyroid diseases have been gaining quite a lot of popularity in the media. However, there is still a lot of persons who don't know what or where their thyroid is. We can locate the thyroid gland in front of the neck, right above this little like V shape we have in the chest. The thyroid gland is here. It's a really small gland. It's like 2 centimeters high, 2 centimeters thick, and like 4 or 6 centimeters wide. But it's a really important gland since the hormone that it produces, that's its main function, produce thyroid hormone, has to do with basically every bodily function. I mean, thyroid hormones act on almost every cell of your body. So when we have any issue with excess thyroid hormone or too little thyroid hormone, then the symptoms can be so varied that it's very difficult sometimes to pinpoint that, okay, this is due to a thyroid disease. But yeah, essentially it's a hormone that this gland produces, and this hormone controls so many functions in the body. For example, our ability to produce heat, regulates body temperature, our metabolism, our growth, the heartbeat, the intestinal function, even reproductive functions and stuff like that.
Awesome.
Wow,
Wow.
I know.
So there you go. That's what the thyroid does. Dr. Melgar, I'm curious, how can somebody look after their thyroid? I mean, we're hearing it's a very important function in our body, in the many things our body has to do. How can somebody take care of their thyroid to ensure that they don't have any thyroid problems?
Okay, a lot of the thyroid diseases, it's gonna sound not too good, but we can't do much about it to prevent them. Why I'm saying this? A lot of thyroid diseases is autoimmune. Okay, so autoimmune diseases, essentially, our body, there is a defect in how our defense system recognizes some part of our body, in this case, the thyroid gland. And if it doesn't recognize it as our own, for example, it's going to attack the thyroid gland. So that's like, we don't know yet what's the original cause of that disease. And that's the most common thyroid disease. So there's not much in that direction we can do. What things can damage our thyroid and we should take into consideration?
Okay.
For example, when we have CT scans with contrast agent, these have a lot of iodine. Those iodine can saturate the thyroid gland and cause dysfunction.
Dr. Melgar, I want to ask in regards to age. Because I think sometimes when you think about diseases and think about what can happen to our body, is there like an age more or less that people can start really being more conscious into looking at their thyroids, making sure, we do what's right, well, just taking care of ourselves in general. And is there anything specific that when it comes to age that we should be checking out?
When it comes to age, I mean, you can have thyroid diseases at basically any age. What we can say is more that women have more thyroid disease than men. I mean, usually about 7 women have thyroid disease for 1 man. So yeah, we have a lot of more women with thyroid disease than we do have men. And with regards to age, for example, during the fertile ages of a person, referring in this case to a woman, it's mostly like you have more the autoimmune diseases. Later on in life, you have like what we call nodular thyroid disease, multinodular goiter. So the type of thyroid disease we're going to encounter going to vary along a person's life, but essentially it's mainly a disease that's more common in women.
Awesome.
Why
Dr.
you
Melgar.
awesome for that?
I mean,
Awesome for that, Kevin. Dr. Yahoo, you say awesome for that? It's not awesome for women.
It's not awesome indeed. It's really a fact right there that we have to take into consideration. I was just saying, I was just moved by his son joining us on Sun Up on 7 too.
Okay.
I'm seeing him right there. Right. So, Dr. Melgar, I know you're quite busy at the moment, but if you can answer this last question for us, how do we know, or how can somebody know whenever they're having some sort of thyroid deficiency or they need to go and get their thyroid function checked?
For sure is having a thyroid function test, okay?
Okay.
However, when can we suspect that someone has a thyroid disease? If we look at one of the extremes, and that's hypothyroidism, whereby our thyroid gland doesn't produce enough thyroid hormone, essentially we can think of someone going in slow motion. I mean, they think slowly, even your speech is like slurry, your voice can get thickened, they can have some weight gain, they're like very sensitive to cold, they're too tired, they usually want to just like sleeping, their skin is dry, their hair is falling. In women, you can have like menstrual irregularities or heavy bleeding. So although none of these symptoms are specific to a thyroid disease, those can prompt someone to seek medical attention and have a thyroid function test done.
Okay.
And then you have the other extreme whereby you have excess thyroid hormone. And in that scenario, it's like the opposite. Someone is on fast motion. Your heart rate is very fast, you're trembling, you're losing weight, you have a lot of anxiety, you're always like feeling heaty, you're like nervous, you're going frequently to the bathroom, stuff like that.
Wow.
Yeah, my aunt has it, so I know about that.
Yeah, I know a couple of persons that
I
have
know a
it
couple
too.
people that have, besides from those family members that have it. I'm forgetting the question I was gonna ask, because when I was like, oh my goodness, for women, we just be taking L. Oh, question. That's the last question because I know you have to go on.
Go ahead.
Your father duties.
Yeah.
In regards to testing, how often should someone go get tested for their thyroid disease?
The consensus, there is no association that recommends routine thyroid testing. Okay. It should only be tested when there is a medical suspicion of a thyroid disease. If you are otherwise feeling well, normal, there is no reason, there is no recommendation for you to have a thyroid testing just routinely.
Okay. Dr. Melgar, I have one last question. I've met quite a couple friends or persons that have said, I had my thyroid removed. So what kind of impact now having your thyroid removed has on your body, given all its functions that it has in our body? And for persons that have their thyroid removed, is there like any post-care things that they need to do to ensure that their body is still functioning at an optimal level?
Yeah. When the thyroid is removed, the impact it can have on a person's health, it's going to depend on why was the thyroid removed. No?
Okay.
There were several reasons the thyroid can be removed. But essentially, if we remember that the main function of the thyroid gland is to produce thyroid hormone, Then if the thyroid is removed, what we do is that we give that person the hormone that the thyroid is not producing.
Okay.
So most people can have a pretty much normal life when your thyroid is removed. Of 100 people, approximately 85% would have a basically normal quantity and quality of life. But yes, there's a 15% of persons who, despite having enough thyroid hormone in the blood, for example, still continue feeling unwell. Those patients can be challenging. However, there are several strategies which we can use to try to help them regain their quality of life, because that it's more a scenario whereby the quality is more affected than the quantity.
All right. Dr. Melgar, thank you so much for your time to clarifying to us what the thyroid function is and its function in our body, and of course bring this awareness to the public. We also heard some really good news, good things that you're doing in Merida and your role in endocrinology. So we want to say congrats, and that we're very proud of your accomplishment and everything that you're doing. So we hope
Definitely want to get you on if you're going to be in Belize, we'd love to have you here too, but want to get you on for our next conversation. Talk about your accomplishments and then also, go into another conversation, because Dr. Cervantes was saying that you have a wide array of things that you will be able to specialize in. And so those are definitely conversations we would definitely want to take to our viewers at home. So, but we know that Sorry?
I promise you that whenever I go to Belize, as soon as COVID permits traveling to occur more without a lot of hassling, I'll be happy to visit you.
Yes, we would love it so much. And by all means, I know you have to go and take your son to school, as reliable sources told me that. And so, thank you again for having this
parenting is a very important part of my life too. So
very much so. So don't let us stop you there. Thank you again for giving us your time, and have an amazing, blessed day, you and your family.
Yes, Dr. Melgar.
Once again, thanks for the invitation.
Okay.
No problem.
Right.
Well, we're continuing the conversation here with Dr. Cervantes, because we got to pick your brain. We got to still use what we have here. And so, MS, we were talking about how, I think it was 2 days ago, we were talking about Marilyn Vanson, a recent artist that just basically talked about, her journey with MS. And her brother came on yesterday talking a little bit about, the symptoms that she's been facing. But something very interesting is that it was about 4 times she went to different specialists and finally got the diagnosis, because it was very hard to discover or understand that she had MS. And it's something that some people have, some people don't have. And so we wanted to bring the conversation and just awareness of what MS really is, and how people can be able to know, maybe prevention ways, and also just how to live with it as well. And so in regards to that, I know David gave a synopsis of what MS is, but from your perspective as a doctor, could you define what MS is?
Well, firstly, I want to say that Mr. David Vanson was very eloquent. Anybody would have thought he's a physician.
Yes, all right.
But let's be honest, he explained it, right?
Yeah.
So I'm just going to recap.
Okay.
Right? Because you talk in layman terms. And so multiple sclerosis causes per se, it's not known. Usually affects women more than men. Why? We don't know. It's usually younger women. They're what we call peaks. So there could be an early peak, like between the 20s and 40s, and then there's a little, like, not a rest, but not so frequent, and then afterwards there's a later peak in life. Like I said before, it affects more women than men. What is it in a nutshell? It is that it's an autoimmune disease. In other words, your defenses. What are your defenses? Your BDF, your soldiers, your firemen, your customs, your immigration, all your authorities in your body, they turn against you. The immune system and nervous system are intimately related. So when a person has multiple sclerosis, it's horrible if your immune system is turning against you. And what happens in a nutshell is that a nerve is like a cable, like a charger for a laptop, which is, the concept is perhaps a copper wire and it has a plastic on top. So the plastic, which we don't have plastic in our bodies, it's a special type of fat, it's called a lipid, and myelin, and MS is going to affect that covering. So if I were to take a penknife and I take the charger from my laptop and I peel it off, or any cable, I peel it off, then it can spark. It's a short-circuiting. And that short-circuiting can cause symptoms depending what region of the brain that is being affected. So if it's in an area that is controlling feeling, people can have abnormal sensations. Perhaps, maybe the part that's controlling one side of the body, my face, perhaps my arm. in that specific region. I can start to feel, well, like maybe things crawling up my face, or I can feel burning pain, or I not feel, or any little breeze, and I feel it more than I should feel. If it's affecting other areas that have to do with movement, then people can start to have a loss of strength, a loss of function in an arm, in a leg, if it's in that specific region. And also, of course, there are other regions in the brain that have to do with human emotions, with memory. If it affects those areas, then my everyday functioning is also going to be affected. So you cannot say that these are the specific symptoms of MS. It all depends if it's 1, 2, 3, what areas of the brain, and it can also involve the spinal cord, where is it being affected, and depending on that is where the symptoms are going to come from. There are times, unfortunately, that people already have the beginnings of it, and we unfortunately have a thing in our country that a lot of doctors try to hold on to patients. So we have to know, if it's not my field, let him or her go to the appropriate specialist, because time is of the essence. So I wouldn't sit here and try to tell you I can take care of endocrinology or heart disease. It's not my area of expertise. So the sooner you have the suspicion, the sooner you go to the expert per se, then you can get the appropriate diagnosis. That is very important.
Okay. Doctor, we are aware that MS is something that doesn't have a cure.
Yeah.
And likewise, it's difficult to treat. What makes MS something that's difficult to treat? And if we look at our Belizean context, how comes that we have that deficiency in providing services for people with MS?
Well, when it comes to the world of high specialty, we're a poor country to begin with, and we're not going to attack the Ministry of Health and Wellness. I mean, being a poor country and the lack of planning from many years back in many areas is what has us with the inability from a public sector, that's my opinion, to be able to address it. From a private practice perspective, the medications, well, the diagnostic studies, primarily the MRIs and also the medications, getting to the diagnosis, it's expensive. So it's not only in Belize. In fact, the medications for MS are not available in Belize unless you're able to special order through a pharmacy or a hospital or a doctor's office. We don't really have sitting on pharmacy shelves medication for it because it's terribly expensive. It is not affordable. And of course, it is of the interest of big pharma, I mean the big pharmaceutical companies internationally, that the price should stay expensive. They don't make it affordable the way it should be. And many times when people want to source the medications, we have to look to countries like Guatemala and Mexico where they do have it available and to source it from there. But even sourcing it from those countries, it is very expensive. We cannot, as Belizeans, afford to get it from the States because the price is even more expensive.
And in regards to the treatment, so as you know, like when we look at HIV and AIDS and the treatment that has with that, it helps you to be able to live. And so you mentioned that it's not something with a cure, but if someone is not able to get treatment, what then there happens? Like, how is it something that fast just starts to just tear apart the body? Because I know it deals with the immune system. So how does that work when it comes to treatment and being able to access that?
Well, it depends on the type of MS. There are different types. I won't go into the names, but you have some that they're very slowly progressive, very slowly progressive. You have others that are they're very fast in their advance. They're a pair and they're very, very aggressive. And then you have a type that perhaps is the more frequent one. And I'm not saying it's best for somebody to have that, but if in not too good at diagnosis like MS, you have the one that you have an attack and then like it relaxes you, right? And then you have an attack, you never know when, and then it kind of relaxes you. So depending on the type that you have is the quality of life you will have depending if you have the medications or not, you have access to it. So in Belize, we don't really have the medication, as I said. Some doctors, if and when, depending on what the patient has, may prescribe steroids. Those could help at times they may not help. And other measures, depending what is affected, perhaps a person may need physical therapy, occupational therapy. Of course, many times they need counseling, not only the support from their family members, but also at times they need to see the counselor or the clinical psychologist, sometimes even the psychiatrist, because it does take a toll on your life. You have this life that you conceptualize, you're living very nice and easy, and then suddenly your life turns upside down by a hidden enemy that you did not ask to have.
Wow.
Wow.
I'm thinking, because I know Marlon, so hearing all of this is just wow.
Yeah. And the many people that are going, that are also suffering.
Now, there are experimental things that are coming around. So you have these medications, but now the world is turning. So now there are technologies of which we have this in Belize already, is we have a technology that's called non-invasive brain stimulation. I'm not saying per se that MS will be treated with this, but non-invasive brain stimulation, the concept behind it is the application of magnetic fields on the surface of the brain, the cortex of the brain. And what you do is that you retrain the electricity in the brain, you rewire it, if you want to understand it that way, and then that trickles down into the deeper regions of the brain. So it's not going to reverse. Many times what it does is it slows down the progression of things. And I will never be crazy enough to say that you don't take your medication. Whatever your doctor is recommending, you have to do. So these new technologies is what BIIN is getting into, to diagnose and to treat. And MS, we know that with non-invasive brain stimulation, the people that have fatigue, MS, and they have fatigue, it helps them to minimize the fatigue, and sometimes it helps them a bit with when they've lost movement and they strengthen their arms or their legs, and they have lost sensation. It helps to minimize that to a certain level. I know these are very kind of sophisticated concepts. I'm trying to make it in a very put it in a little shoebox for people to understand.
Well, I totally understand, because we have some very young viewers too here. So it's good to have them understand, because I think, to be very honest, before Marlon had announced her journey, I did not even remember about MS. Like, I've heard about it before, like, briefly, but to say, like, I've know now what the symptoms are, what happens, and so forth. It's just a lot to take in, I'm sure, for a lot of people to understand these different diseases out there and what people are facing. You know, the fact that you don't have cures for these and the medication is so expensive. There's a lot of people that are going through hard journeys when it comes to their health and their well-being in that regards. But I have to say thank you so much, Doc, for being
Cervantes.
here, for giving us all this information, for BIIN as well. I would really want to get you back again to talk a little bit more in depth with that and talk about the other services that you provide and, you know, dissect. Because when we talk about Wellness Wednesday, we're always trying to give people new things. So it's always something new that we want to let them understand, because we always talk about COVID, but there's much more things to talk about when it comes to health and wellness. Yeah. So I thank you for being here. And for those out there that, you know, Dr. Cervantes just said how that the medication is extremely expensive. There's actually a barbecue, a fundraiser happening this Saturday. I'm forgetting the exact location. Yes, the
there's
flyers
a flyer.
right here. The flyer's right here, yes. So Saturday, January 29th. Oh, sorry, it's the 29th. At Battlefield Park at Belize City at 9:30. And so it's going to be having live performances and all these things. So be able to support and help to raise funds to help support the journey that this is going to come. Because like you mentioned, even with getting it a little bit more, a cheaper price, it's still really expensive.
Right. I'd like to add the contact information for anybody that's viewing the show and would like to reach out to support to Marlon Vanson. You can reach out to Ashton Wagner at 614-4232. Her brother, David Vanson, 614-5123. And her mother, Marcella Vanson, at 614-327-3723.
I was like, what were you reading?
Let me repeat that number. Miss Marcella Vanson at 614-3723. So there you go. If you can support in any way, maybe doing a referral, finding a pharmacy that has the medication available, reach out to them. Of course, there's many ways how you can support Marlon Vanson's journey with MS. So with that, I want to say thank you, Dr. Cervantes, for being here with us.
We truly appreciate your presence here. And so we go to our next commercial break. But when we're back, we're going to be speaking with Dr. Eck. And we're going to be asking him about a special name that we got from reliable sources, but also an important conversation about COVID and children, Omicron specifically. And so for parents out there, for teachers out there, for anyone in regards to children, this is a very important conversation you don't want to miss. So stay tuned.